Hello, in this video we are going to discuss about osteoarthritis, but before this we discussed in detail about rheumatoid arthritis. If you have not checked that video, the link is in the description. You first go to rheumatoid arthritis disease and then come back to osteoarthritis, because we do here compare both the things. That's why. Okay, now coming to our osteoarthritis disease, you see it is the end result of degeneration of articular cartilage. When we discussed rheumatoid arthritis, what we discussed, it is because of those joint structure, that joint structure gets damaged, that articular cartilage gets damaged, that synovial membrane gets damaged, and that lubrication does not happen. That's how we are feeling inflammation, that's how we are feeling pain, redness, everything. Similarly, here also it is end result of degeneration of articular cartilage. But you have to remember, it is not an autoimmune disorder. So age is an important factor over here. As age goes on, the joints, that articular cartilage gets damaged, and that's how the two bones get rubbed against each other, and that causes a lot of pain, a severe pain, inflammation, etc. But it is not because of immune system mistake. I mean to say, it is not because autoimmune disorder. Okay, you have to remember that point. That is the first difference. Coming to second difference, in case of symptoms. In case of rheumatoid arthritis, how did you observe? We observed symmetry, right? Suppose metatarsophalangeal joints or metacarpophalangeal joints, metatarsophalangeal joints, or distal or proximal, these phalangeal joints we see symmetry. If you get here, you also get here. We see symmetry in case of rheumatoid arthritis, whereas in osteoarthritis we do not see symmetry. Generally joints are affected, bones are affected. Okay, we see pain, we see inflammation, we see tenderness, everything we see, but it's not symmetry. That is second difference. And third difference you have to remember is rheumatoid arthritis can cause extra-articular symptoms, like it can affect brain. If interleukin 1 goes to brain, it causes fever. If fibroblasts are accumulated in the lungs, it causes pleural effusion, chances of pleural effusion, chances of decreased gaseous exchange, everything can happen in case of rheumatoid arthritis. Also, in case of they decrease the muscle protein, they break down the muscle protein, that's how they may cause a muscular disorder there also in case of rheumatoid arthritis. Extra articular symptoms are possible, but whereas in osteoarthritis, extra articular symptoms are not there. They mainly restricted to bones and joints, skeletal system only, majorly. Okay, that is the second point you have to remember. And now you see diagnosis. How do you diagnose? In case of rheumatoid arthritis, we see rheumatoid factor and anti-CCP, right? Whereas here, no such things. We generally watch for X-rays for any kind of joint erosion is there, or any kind of deformity is there. We generally see for those things. Whereas in those things, in rheumatoid arthritis, we see for rheumatoid factor, anti-CCP, and if at all we observe X-rays, we observe for deformities like ulnar, we observe for buttonhole deformities, etc. Those things we observe, but here no such things. Okay, that is another difference in case of diagnosis thing. Okay. Now you see, symptoms we discussed, right? Comparison, almost we compared all the things. But remember one thing over here, osteoarthritis is a degenerative joint disease, degenerative arthritis, and wear and tear arthritis. You just remember these 3 points. Okay? Now, coming to treatment. So, in rheumatoid arthritis, what we discussed about NSAIDs, we discussed about DMARDs, we discussed about biologics, we discussed about corticosteroids also. Whereas here, mostly we restrict to NSAIDs, mostly. Most of the time we restrict to NSAIDs. You see, NSAIDs, if at all you see, we'll initiate for 7 to 14 days therapy. We'll observe for the symptoms, like they are getting down, remission is there or not. We observe for such kind of things. Okay. Most popular drug is paracetamol, 500 mg, 4 to 6 hours a day. I mean 4 to 6 hourly you can take, no problem. So tablet paracetamol, maximum we can get benefit out of it. If not, we go into tablet ibuprofen. You can see the dose over here, 400 to 600 mg, either 2 times or 3 times a day. But remember, all these drugs should be given after food and with more amount of water. And either tablet ibuprofen, or you can give tablet diclofenac sodium 50 mg thrice a day, or you can give tablet aspirin 350 mg 4 to 6 hourly, maximum of 2 doses. That's it in a day. Okay, you can give any of these drugs. It's up to physician's choice whether the patient can be tolerated to this drug, whether we have to change the drug. It depends on the, again, symptoms remission, whether they're getting down or not. It depends on the physician choice. But these are the generalized drugs that we generally use. Coming to topical applicants. Topical applicants is really important in case of rheumatoid arthritis also. It can be capsaicin, it can be menthol, it can be camphor, it can be NSAIDs topical applicant, anything it can be. The topical applicants gives the symptomatic relief. They do not penetrate into the joint space, but they give the symptomatic relief for the pain. That is the use of topical applicants. Okay, there are many topical applicants available in the market. You can just go through the Google or any kind of a website you can wish. For chronic things, these are the drugs for acute pain. Acute pains means, all of a sudden you are getting pain. For those things you can observe these drugs. For chronic means it's a prolonged disease, right? Because we discussed it is a degenerative disease, right? Degenerative means slowly it gets degenerated. Slowly the articular cartilage gets degenerated. Slowly that space gets degenerated. So it is a progressive disease, slowly it develops. So chronic disease we can also term it like, yes? For chronic disease, we have to use diclofenac sodium of sustained release. So it will be like pretty much helpful in case of if at all you use tablet diclofenac sodium, okay? Of a dose around 100 mg to 75 mg to 100 mg, it's again up to the physician's choice. Or you can use the tablet piroxicam of dose 20 mg. Again, it's up to the physician's choice. I'm just giving the generalized drugs, guys, okay? Don't just depend, okay, you have to use these drugs only. It's up to the symptoms. If you're good enough to, decrease the symptoms with one drug, it's enough. Then, if not, the physician changes the drugs on and off, okay? Now, that's it with the treatment part. Now coming to some sort of patient counseling. In case of osteoarthritis, as we discussed, age is a major factor, right? We have to make sure that we are not overweight. If you are overweight, you have to decrease your weight, because you should not keep pressures on joints, right? If you're overweight, definitely there will be a pressure on joints. When the articular cartilage gets damaged, what happens? The joints, the bones get sliding each other. The bones touch each other, we'll feel a lot of pain, a severe pain we'll feel, okay? So if you're overweight, you have to put your weight down, that is one thing, and you have to do mild exercises, okay? The stretching exercises definitely helps you slowly to get the relief from the pain, etc. Stretching exercises is important, and sleep. Adequate amount of sleep is important, because you have to give rest to your muscles, you have to give rest to your bones, you have to give rest to your joints. Okay, so adequate amount of sleep is really helpful, and the most important thing is hot and cold therapy. Hot and cold therapy also sometimes relieve the symptoms temporarily, but not permanently, but temporarily they relieve symptoms. You can observe those things. So yes, this is regarding osteoarthritis. So I hope we got clear differentiation and comparison between rheumatoid arthritis and osteoarthritis. Okay, so after this, you just go in detail. You just refer good textbooks, or you just refer good websites. You just go in detail about the disease, because these two diseases mostly they depend on non-pharmacological treatment, like how we take care of ourselves, like uses of canes or walkers, or how we are managing with pain, how we are managing with some natural therapies also, if at all you are interested. So it all depends from person to person, okay? So if you are really suffering from these diseases, you just go through a lot of material, definitely you will get cured. Thank you for watching.